Ladies and gentlemen, welcome to the webinar. We continue our series on healthcare, privacy in healthcare. Today's topic is the potential perils of health and medical devices connected to the Internet of Things. Your presenter today is Eric Boughman. And if you'd like a copy of the presentation, if you go to the webinar console, you can download a copy of the presentation there. You'll also see a firm brochure you can download as well. So with that, let me turn it over to our presenter, Eric Boughman.
All right, thank you, Tony, and good afternoon, everybody. Again, my name is Eric Boughman. I'm an attorney here at Forster Boughman in Central Florida. We are a business law boutique, and my practice involves representation of several businesses, including healthcare-related businesses and technology companies, and also issues that arise when technology and healthcare intersect. And we are seeing more and more of that lately, which has given rise to our series of webinars this year on privacy in healthcare. A lot of our focus is not on traditional privacy issues that arise under HIPAA and state law and so forth, but really some of the issues that that haven't traditionally gotten as much discussion or have become greater issues with the advancements and developments in technology. And we're going to talk about those today. I'm very pleased to have as a guest today Tony Peasy, who's the president of TechSpring, a computer technology and consulting company. Tony has a master's in computer science and is my go-to person for technical issues that I need to understand in order to communicate those in plain language to clients, and both during seminars and webinars. So welcome, and thank you, Tony, for joining.
Hey, thanks for having me, Eric.
All right, so we're going to pop on to our first slide, which will give us an agenda, which provides an overview of what we're going to talk about today. We'll do a little introduction and tell you where we're going to go with the discussion. This is going to be a discussion with Tony and I, and if you have questions, we have an ability to monitor those, and you can pop those into the webinar application. Or if for some reason there's something that comes up and we don't get to your question during the webinar, if you want to shoot an email after the webinar, please feel free to do so. At the end of the slide presentation is contact information on how to reach me, and you'll also be able to reach Tony. So we'll do a little introduction. We're going to talk about some of the risks of specifically devices connected to the Internet of Things, with a focus on healthcare related devices, both medical and devices that are not considered traditionally medical devices, consumer-facing devices such as exercise apps, diet nutrition apps, and so forth. We'll talk about some of those specific devices and the examples. We'll cover some law and regulation that pertains to the issues that we discussed specifically with regard to privacy and security issues, touch on best practices, and we'll talk about why this is important and where we're going and where we think we're going towards the end. We envision there's a lot of material here as we were putting this presentation together. There's a lot of different directions we can go with mobile health apps and digital health, telemedicine, FDA issues, and we really can't cover that all in one hour presentation, and really it's too dense to try and cover and absorb it all. So we envision that this is going to be something that we talk about in different aspects over the next couple of months, and hope that you are able to join us. And before I move on, I'll also mention that if you have any interest in having us speak to a group and present on any of these issues, please let us know, and we are happy to do that. We regularly travel. I was just in Wisconsin a couple weeks ago doing a privacy seminar, so we are happy to come and present these issues in person. So with that, let's pop over to our next slide, please. All right, so here's some statistics that come out of the Office of National Coordinator for Health Information Technology. This is a division of HHS, and this shows the usage of health and wellness applications among tablet and smartphone owners 2017 to 2018. So this first chart here gives an indication of how many people are using electronic monitoring devices such as Fitbit, blood pressure devices, and so forth. It's almost a third of the population, or a little over a third of the population, according to this study. Tablet and smartphone users, if you see a couple lines further down there on the chart, constitute about almost 85% of our population. That number actually in the US here is surprisingly low to me. I would expect that to be higher, but in any event, that's what they found. But among tablet and smartphone users, almost 50% now have some type of health and wellness app loaded onto their phone or tablet that they interact with. So let's go to the next slide, please. Now, among those who use health and wellness apps, about 75% use it to track progress on goals, and around 30% of those folks share information with a healthcare provider. So now we've got not only the use of the app, and the app is connected to the internet, which presents its own issues, but now we've got data from that app being transmitted back and forth between healthcare providers, between the app company, between third-party vendors and so forth. So you can see that the use of these apps keeps growing, and of course the legal issues surrounding the apps will grow as well. And there is a little bit of right now there's a little bit of a push-pull involving various federal agencies on what degree these apps will be regulated, particularly when we talk about health and wellness apps. Where's the line drawn between a medical device that may be subject to FDA regulation and just a consumer-facing health and wellness app? And we'll talk about that a little bit more as we get into the slides here, but I want you to be aware that that is an ongoing discussion. It does not have a clear answer right now.
So we're seeing a strong increase here.
Oh, go ahead.
Yeah, so I'm just, one thing is, between tablet and phone users, I mean, so I think that last slide said it was like 85% of the people are in that area. So it could be they're using one or the other. But we're also seeing an increase here, this slide here, in people actually, using these health-related apps. So which means that they're collecting more data on that. It's not just email or things that you may have been using in the past, but now it's also vital statistics that are being recorded.
Yes, there's everything from activity tracking, obviously on a Fitbit, or I think that you can do that on an Apple iWatch. I know my Android phone has a little application that I can open up that interacts with the navigation so that it can tell me where and how far I walk or run.
Yeah, this is really good for healthcare in general, I think, across the population. I mean, what's the old Peter Drucker, what gets measured gets managed. So at least people are starting to measure it, and hopefully we'll be able to manage healthcare a little bit better in the future.
And that's a great point. And I'm glad you brought that up. As I talk about the development of the law and how federal agencies are looking at this, I want to emphasize that this is not something where the government, the old line about Ronald Reagan and I'm from the government, I'm here to help. What are the two scariest sentences in the U.S. vernacular? But here, I think the government regulators understand that there's a lot of benefits to be found with people taking an active view of their health and wellness. And so they don't want to kill the industry. They don't want to discourage the industry. And I think some of the policy decisions that we've seen, especially with the FDA sort of taking a stance more recently that we're not focused on regulating consumer-facing health and wellness apps. You've got these new offices, some of them new and some of them becoming more active, such as the office that provided these studies, the Health Information Technology Office under HHS, that's devoted to trying to figure out how to balance the risks and regulations in society. But generally, we want people to use this stuff. but we want to make sure that they're protected when doing it, and that the companies don't run amok. So that's a great point that Tony, that more people are using it and there's a lot of benefits to be had. And so we'll pop over onto our next slide, and here we talk about a little bit some of the opportunities that are presented. Obviously, people are taking a more active role in their health and wellness, more accurate and faster feedback loops, both in health and wellness and in medical. We see that with, for instance, blood pressure monitors that can be where the information can be shared with healthcare providers. We have data that is more readily available, and it's more, we can do something with it. I know, for instance, with if you know anybody who's diabetic, we have to occasionally, a diabetic has to go through testing, and it used to be sort of a really laborious process to do blood sugar monitoring, to do to create a scale to monitor blood pressure or their blood sugar throughout the day, and now that can all be done digitally, and we can actually provide responsive information in form of insulin directly into the blood. Yes, go ahead, Tony.
Yeah, it's not just apps either. I mean, so we're collecting data, of course, on phone apps, but you can see from the picture here, this is different devices as well. And I think this is the crux of the message here on privacy. We're used to protecting computers, laptops, and now smartphones, but now we're starting to see additional IoT devices. You can see on the picture here, you have a picture of the glasses. That's like Google Glass, and all these other monitoring devices that aren't traditional smartphones or computer devices. They're newer devices. So I mean, this is really where we need to also protect, not just the data that's being collected. That's one piece, but I think it's also the types of devices that are connected to the internet that have to be protected as well.
That's right, and that's the crux of a lot of what gave rise to the idea for the seminar. And just as a little background, I was doing some work on some other privacy issues that were not specifically healthcare related. It had more to do with digital assistants, such as your Alexa, Siri, and those devices that are essentially always on and always listening. But there's a lot of overlap, because all this stuff is connected to the internet. It gives rise to new opportunities, but new risks. And so. Yeah, and that's what also government regulators are recognizing, that that these risks exist, and you have folks who have less than good intentions that are trying to exploit them. So when we talk about risk, this slide here, I was reading a report from somebody at the FTC, and he presented, I forget which group it was, but this official from the FTC noted that health insurance credentials were available for sale on the dark web for $20 per credential, and that's not a full health record. That's just health insurance credentials. $20 per record. And if you think about a breach that may involve thousands of records, what the potential value could be there, and why we're seeing breaches on a regular basis. A complete medical record could be purchased for $1,200 and up. Though that number is shockingly high to me, but it does help explain why we see breaches occurring and breaches attempted on a regular basis. And behind the scenes, I mean, Tony, you deal with providing security, so you get to monitor and see all the attacks. What would you say about the number of attacks that come in on various systems and businesses on a regular basis?
Oh yeah, no, you see attacks on a daily basis. I mean, they're almost constant, depending on the system, of course. But I mean, this doesn't surprise me a whole lot. I mean, this information, with this type of information, people are using this for other fraudulent scams.
And yeah, so the numbers are shocking. And I'm going to hopefully we'll talk about some more information here, good or bad, that may or may not be shocking. But moving into the next section here, identifying specifically what some of the risks are. First, and Tony, you noted this earlier, said it a different way, security, IoT devices aren't looked at like computers, and sometimes I don't think even people look at their phones and tablets like they do. We're so focused on controlling the computer environment in an office, but a lot of the breaches and a lot of the issues that we see come from other devices that are less common, and the federal regulators have recognized that as well.
Yeah, I think we're going to see more of that as we go. There's a lot of software out there to protect against viruses and malware for computers, less so for smartphones, and even less so for these other IoT devices. But I think we're going to see more and more of this because people are realizing these are, the hackers are out there realizing that they are these are softer areas that they can get into. Not many people are looking at, say, for example, a temperature monitor that they may have in their house connected to their internet that's also connected to their internal network. So somebody trying to, find people that have a particular model of temperature sensor or rain meter, something like that. I mean, they're really thinking outside of the box, but it's any way they can to try to get into your computer network or your computer system.
And we hear all the time about updating your security settings on your computers or having somebody available. I know for our office, Tony's group takes care of that, making sure that we get all the regular updates. But how do you do an update for your smart thermostat, or for your connected blood pressure cuff that can download information into your health app? I wouldn't even know where to start.
Yeah, much of it is dependent on the manufacturer of the devices and the software. The rest of it is securing your network. So if you're going to let something connect to it, you make sure it's trusted and take proper precautions as far as that goes. But if somebody gets into the actual device, it gets kind of tough because you need to trust the device. It's kind of interesting. Somebody asked me about setting up a phone where they wouldn't have to put any of their personal information in it. So, you can set up a phone, you'll be able to make calls, but then you're not going to be able to get your email. You're not going to be able to get the weather for where you're at because you're not telling it. You're not giving the phone any information. If you don't put any information about your account or your location, you're not going to be able to use the maps. You're not going to be able to get the weather. You're not going to be able to use your own email. So it makes the device somewhat unusable if you don't want to provide any information into it. So unfortunately, you have to give it some access. And some information to be useful, and that's where some of these things we have to really scrutinize what we're giving access to, make sure we know the manufacturers. I mean, we've seen this whole thing with Huawei now, and the U.S. not wanting to let them in because they believe they're a Chinese state sponsor of some sort. But just imagine that if some manufacturer has a hole in their system, either knowingly or unknowingly. What havoc that could wreak in a anything that you connect to.
Yeah, and the common response may be, or traditionally may be, as you said, well, you don't have to connect, you don't have to use these devices. You don't have to carry a smartphone around. So if you're able to get tracked on your smartphone, for instance, by government officials, you've consented to that by carrying a device. So there's no Fourth Amendment issue there for unreasonable search, for a constitutional privacy issue. And our own Supreme Court has essentially said that's not realistic. In order to participate in today's society, you pretty much have to carry. I mean, most people are carrying smartphones, and they carry their entire life in their pocket. Steve Jobs said, 1,000 songs in your pocket? Now everybody carries their photos, their files, and then access through cloud technology. So that argument that you voluntarily give up that information because you carry a phone or tablet is going away. And that's I think, an important policy change that we'll see over the next few years. And so we have security issues, you have privacy issues, of course, and that's the gist of the seminar. And what's interesting here is where we're really talking about HIPAA. Obviously, you have privacy rule, you have security rule, but you have data on these devices that's either not produced by covered entities or business associates, and then you have data that's either anonymized in accordance with HIPAA standards, or if it's not HIPAA data, what does anonymized mean? And so we see companies like, I don't want to pick on Apple, but I've read, if you ever sit and read Apple's terms and conditions or Amazon's terms and conditions with regard to Alexa, you will commonly see that they collect data, but they anonymize the data before they allow third parties to access it. But what does that mean that the data is anonymized? And so I'll give an example that I read from another a study from a professor out in, I think it was Berkeley. California is always, I make fun of California in a lot of webinars because they have goofy laws sometimes, but here in this privacy stuff, they're really cutting edge. And out at a university in California, there was a professor that wrote a paper, and just using statistical analysis, we figure if you have the date of birth and zip code of any particular zip code, if you get the zip code and you get dates of birth, you can narrow that down to 4 people in a particular zip code. And if you tell me that it's male or female, now with no names, no other identifying data, just date of birth and zip code, male or female, and I can narrow it down to you or one other person. And if you think about it in those terms, it really, I think, brings to light the idea that, anonymized doesn't necessarily mean that it can't be, that you still can't be identified, and it doesn't mean it can't be put back together. And so there's another cool study, and Tony, if you flip on to the next slide, we'll talk about that one. And now, so this is another one that I just read recently, and this was in the, this was available at the, what was the source? It was out of California, but it was on the on an online medical site. I don't remember which one, but in any event, the study was available for review. And what happened here is they took data that had been de-identified by HIPAA standards. So there's 2 standards. One, it's you remove 30 some pieces of demographic data, or the other way to anonymize or de-identify the data is they have it certified by an expert as being de-identified. That data is then available from a covered entity, and it can then be redistributed once it's been anonymized. So these researchers took that anonymized data, they combined it with data that they were able to obtain from other non-HIPAA sources, such as a Fitbit or a wearable activity tracker, or just data that was directly input on Facebook by users. And when they cross-referenced those two things, the anonymized data with the data that was available from a non-covered entity, using machine learning, they could re-identify the data. And so, in another seminar, I think when we have a little more time, maybe on the next one, we talk a little bit more about machine learning and AI and what that's able to do. And maybe Tony or somebody can jump on and explain that. But, that process of essentially processing that information to re-identify it, they've essentially, the researchers finished by saying that our notion of de-identifying data today is antiquated and is no longer reliable. And I'll give you an example. One that they pointed out in the study was taking the anonymized data and comparing that against somebody's Facebook page and knowing that that person was pregnant. Once you knew they were pregnant, you could figure out their activities and their activity level around the pregnancy. They were able to put that back together and identify the person from anonymized data from a covered entity. So anyway, I don't know if I explained that well enough, but it's scary stuff. And if anybody wants a site for that research, you can shoot me an email and I can send you that. It's kind of an interesting paper.
Yeah, so, this is really interesting because when you want to give people data, that they want it, anonymized. But as you've just shown here, I mean, you can deconstruct that pretty easily. And again, I think that it builds the other case for encryption, because if you're not sharing the data, you're not using it, at least you could store it, in an encrypted format. So if somebody at least does get access to it, it's encrypted. But here is the case where you actually need to use that data to either measure something or to do some type of statistical analysis, and you don't want people to be able to deconstruct this. So there's going to be some kind of points where we're going to have to make sure that that are maybe protected a little bit more tightly, such as birth date, like you had mentioned.
Well, and we're going to see this more as people use apps to communicate with their healthcare plans and their healthcare providers. And that's what we're seeing more and more of. And as that happens and you have that information being communicated, you're now going to have information that's not traditional HIPAA personal health information that's being communicated and combined with traditional healthcare data. And so it's going to become a greater risk.
And I think you're seeing that already on the illicit side. That's why the cost of the health record is so high on the dark web.
Sure. Yeah, I guess if you buy the record,
it's not high, but $1,200 for a health record for a full record. But there's a lot that they can do with it. And
so now, another risk is obviously misuse of the data. If somebody gets that data, it's one thing for somebody to hack in and get the data and use it for nefarious purposes, but consider the situation where, and we have something like this here, where you wear an activity tracker so you can get discounts for either on health insurance, or you can get money back from your healthcare plan for providing activity information. And I'm wearing one right now, and it communicates, and I downloaded into a little app, and it says how many steps I get, and I've earned like $200 this year. It's awesome in that respect. But now take that information and consider the ramifications of employers or insurers or even creditors having that information and access to your daily habits. And here I propose a few scenarios. What about insurance companies using that information for rating factors? If you think about daily activity, maybe that's fair, maybe that's good. We'll get into things like heart rhythms and other health information that maybe you don't want to share with as broadly as that information might be shared. Another potential issue is with employers. Could employers have they'll have that information potentially, or have access to that information if people are through an employee-sponsored health plan and providing that health information or that fitness tracking information. Can they use that, or should they be allowed to use that to make hiring and personnel decisions? For instance, deciding that somebody who's a regular exerciser and steps a certain amount per day is a better employee. And then finally, the last scenario that I throw out here is whether creditors might use the information or be able to use the information to determine somebody with a healthier lifestyle is less of a credit risk, and use it to make either credit determinations or for pricing credit. Now, there's other limitations that go in here, besides having this information, such, I use the creditor example, you have your Fair Credit Reporting Act, your Fair Debt Collection Practices Act, and other regulations that affect creditors. But these are all scenarios that are going to be made possible by this information. And in here, on the next slide, we talk about not only what these folks can do with this information potentially, but some real life scenarios. So let me give a little background on these. In one case, and this was in the news a couple years ago, in Canada, a man had called in to police and reported that he had left the house, and he came back and his wife had been murdered. And police were able to use her Fitbit data with some updates that she had put on Facebook, and they realized from reviewing that data that the story did not match up with what the husband told him. And during the time that he said he was out of the house and she had already been purportedly murdered, according to his story, her Fitbit actually showed that she was up and active and moving about the house, and they ended up using that information to bring murder charges against the husband. So there's one kind of fascinating case. There's a couple more we'll talk about as we kind of go through here a little bit, time permitting. There was another case involving a rape where somebody made false accusations of a rape, another one with an arson, all using this information. And so when you collect tracking information on somebody through one of these apps, the courts into some interesting decisions from the Supreme Court recently, high profile cases, this Carpenter case that came out last year, talked about the types of information that you can gather just from having somebody's cell phone and location information over a period of time. For instance, figuring out if they are a regular churchgoer, or if they go to a health club regularly, or if they are a regular drinker, apparently from their frequenting bars and other liquor establishments, and talked about the risks associated with that. And that's what we see the potential for here. So on this next risk, IoT botnets, I'm going to let Tony hit on this a little bit and explain what this is, if you don't mind, Tony, because we
Sure.
get a little bit technical with DDoS attacks, but certainly with all these connected devices, it makes it more possible.
Yes. So for those that don't know, a DDoS attack is just a denial of service attack. So, for example, if we just want to bring a system down, we just keep making a bunch of requests to it. So it has so many requests that it can't handle them, and then it eventually crashes. So that's the goal of the perpetrator there. So, and then when you say a botnet, when you think of a bot, think of that just as a small program that's just going out and doing something somewhat independently on its own. So in I guess regular thinking, you might think of that as like a drone but that's not controlled by someone. Maybe you have a whole fleet of drones that are out trying to attack something. So in this type of scenario, you have these bots. You have a whole bunch of them that are trying to make requests on different systems with the idea of trying to bring them down. That's what's happening here, and you see this not just on computer systems anymore. Now, I think what we have in this slide here is you're seeing them on other IoT devices, such as cameras, monitors, routers, all other things that are connected to the internet.
And so that the scenario that I toss out here is regular internet devices. We saw a big attack last year on this company DIN that brought down or limited access to multiple websites, including Airbnb, Twitter, Netflix, etc. What would happen if somebody targeted one of these attacks through connected devices at a hospital? And what are the risks involved? And I don't know, I'm not aware of any scenario where that's actually happened or there's been any success, but it's certainly a risk. Tony, how realistic is that risk, or with you in your estimation, is that something that we should expect to see somebody attempt in the future?
Oh no, I think it's something that's already happening. The things that happen every day. I mean, most of the attacks that are on systems are done through botnets, and it just depends on what they're trying to do. If they're trying, there might just be a small program just trying to hack passwords, or just trying to do something very specific, and they just the winner is by volume. So you're not going to be successful in every attempt. So for example, if I go and I try password on every computer, in a particular building, just use the word password. So, that was a popular password at one point. I may not get anybody in your office. I may not get anybody in your building. But if I keep going and keep enlarging the volume, go to the whole city of Orlando, the whole greater Central Florida area, eventually I'm going to get a couple. And so it's a game of numbers. So the more of these, the reason why they use these botnets is because they can send a whole bunch of them out and basically try to hit as many folks as possible with simple little things, and you're going to get some fruit eventually. But yeah, I think they already do this. They already target hospitals. Hospitals are big targets. Law offices, accounting offices. These are very high target areas because they have financial information. They have health information. It's all stuff that they can sell.
All right, next slide, please. All right, so last primary risk we'll talk about is manipulation. Obviously, the more people rely on connected, when we get beyond just the consumer-facing health app and device, and we talk about medical devices, we've got insulin pumps that are able to be monitored by healthcare professionals, pacemakers. There's a fairly famous story about Vice President Cheney under the Bush administration when Bush went under for surgery and Cheney was president for a few hours, how he somehow disconnected his pacemaker because he was worried about somebody being able to connect to the pacemaker via the internet and deliver potentially fatal shocks. And I know at the hacker convention, the reports come out every year, and there was a recent report out of the convention they have in Las Vegas where the people go there for the, white hat hacking and I'm sure other purposes going to this convention, but it's essentially the hackathon every year, and folks hacked into insulin pumps, pacemakers, and showed how this could all be done. Tony, have you ever been to the hacker convention?
I have. We haven't participated in any. In the old days, you'd participate in the ACM, Association for Computing Machinery, but it was more contests on sorting things and items like that, but more practical uses. But now you're seeing more and more hacker conventions where they have contests on trying to hack particular systems, and they're very successful. I mean, there's a pretty small set of tools that they use. When I say tools, I mean different software programs. A lot of them are just written by individuals. Some of them you can actually buy off the shelf. And yeah, you can get into a lot of these devices and wreak havoc. At first, it was just an interesting idea to see that somebody could do it, maybe reprogram one of these devices. But now people are saying, okay, now that we know we can get into them, what can we do? What can we monetize out of it? I mean, so I think that's the direction that a lot of this is going, and that's what scares a lot of these folks, and that's why we have these privacy and healthcare series here.
Yeah, and so yeah, I know for instance in the car industry, there's been a push to separate the anything connected to the internet from the motor and braking systems, and I wonder if we see something like that with healthcare devices where the data and the information section is separated by some hard line between the information and the actual functioning of the device. So I don't know if that's become an issue yet or if that's even possible, but it might be another idea for something we might talk about on a future webinar. It's
definitely being discussed because you're seeing it like when we had some plane crashes recently. Some of the ideas or initial hypotheses are, did somebody hack into this and maybe take over control of the airline? So it may not be happening, a lot yet, but it's definitely being talked about, and I'm sure it's being thought about.
All right, so examples, we've given you what some of the risks are. We list up here. This is not, of course, an all-inclusive or all-encompassing list of potential items from where risk can come, but it does provide a wide range of examples from smartphones to fitness trackers to your Amazon Alexa or your Google Home device, apps where people voluntarily share their data. I use a fitness app called 8Fit that I think is really cool, but there's a little bit of data sharing there. And then, of course, connected medical devices we've talked about. We have everything from insulin pumps and blood pressure cuffs to some of the newest stuff I've looked at is there's a concussion assessment tool apparently that can communicate directly with a healthcare advisors or providers that's being explored for instance, for during football games. So an assessment can be made. EKG monitoring that can be done remotely for babies and for pregnant mothers. And then you have other devices that may not be directly connected, but could be connected to the internet. One cool one I just heard somebody talking about was a Band-Aid-like device that's just a strip that you could put on somebody's leg, and it senses movement, and it sends via Bluetooth, it sends a message to, this could be, for instance, like a provider, like a home healthcare provider, would get a message that somebody who was in bed had stood up, and so when that person moves. So that's the type of device that may not be connected to the internet but can be. So these are just some examples. There's certainly more out there.
I want to stress that these are great innovations and things we need, and I think it's great that they are connected to the internet, that we can share this information and share it with the appropriate people. But I think that's the key. It has to be shared with the appropriate people in a secure manner. So that's what we want to protect against any kind of maluse of this information.
So if you flip over to the next slide, I just want to give a little background real quick on two other examples. And I use this I collaborated with some folks around the US on a forthcoming book for the American Bar Association. It's the Law of Artificial Intelligence that will come out this summer. I wrote the chapter on intelligent eavesdropping. and I talk about these cases a little more in detail. But this first one, it involved a pacemaker. A guy in Ohio had reported his house fire after it occurred, and authorities got pacemaker data and had a professional look at that data, a cardiologist that the prosecutors had retained, and from the activity data in the pacemaker, they matched it against his timeline, and it showed that if he'd actually done what he said, which was he popped up, woke up in the middle of a fire raging throughout his home, packed a bunch of stuff in a suitcase, and bailed out of the house real quick, it didn't match up to his pacemaker data, and that it would have been a different response. And they used that data to charge the guy with arson, and he was criminally charged, and it actually went to trial, and the judge allowed the evidence without ever really considering, I don't think, the longer term implications of, the idea is, well, you've shared that data voluntarily. Really? Does a person with a pacemaker share their pacemaker data voluntarily because they chose to use a pacemaker? I don't know if I agree with that, but that's one example. Another one, another Fitbit case. This one's kind of interesting. A woman in Pennsylvania had contacted police investigators and made rape charges against somebody, but when her Fitbit data was matched up to her actual report, at the time she claimed to have been sleeping when somebody snuck in and raped her, the Fitbit actually showed that she was up and moving around the house. So these Fitbits are pretty popular for solving crimes. These are good uses, I think, generally. But of course, we talked already about some more nefarious uses. So just things to think, for every good, it seems like there's an equal potential risk on the other side. And I talked about this a little bit already, where you wear the health insurance company has you wear a tracking device. Who else are they sharing this data with? A lot of this, we're going to look to privacy policies. If it's not HIPAA regulated information, if it's not information that's regulated under another federal or state law, then that should always be your question. It should be a question for users. You should be asking, well, what happens to the information that I'm sharing? And if you're developing these, or if you're a business that's using one of these or providing these to your customers or clients, I can't emphasize this enough, and we'll talk about it, especially with FTC actions, you need an accurate and clear privacy policy. Under HIPAA, you're required to have your privacy policy, and even if you're not a HIPAA regulated covered entity or business associate, you still need to have a privacy policy that tells people what you do with the data, who you share it with, and you have to follow it. That's just as important. So moving on, we'll touch on, and we're going to move a little bit quickly through this, but again, we're going to do another follow-up because there's some really interesting regulatory information. I just want to give you an overview today so you have a little bit of background and know what laws, where the legal issues lie. First of all, Fourth Amendment privacy protections only apply to government actors. So people that say, well, you can't use my information for this or that because I have a Fourth Amendment right to privacy. True, the government can't access it or use it, but as I've already mentioned, for instance, with the arson case where there were government actors, there's questions about consent and whether you voluntarily provide information by using one of these devices. Earlier I mentioned cell phones. Do you voluntarily share all your cell phone information because you connect your cell phone to a cell phone company provider? You have in Fourth Amendment doctrine, you have the third party doctrine. It says if you share information voluntarily, it's not subject to privacy protection. And so the argument has always been made that, well, any information on a phone that the phone company has, you voluntarily shared. And I think courts are starting to recognize that because a phone company has your phone data, that does not mean that you intend for the entire world to have that. And then moving on to more healthcare specific laws, obviously we have HIPAA. This isn't directly, it's a healthcare, privacy and healthcare seminar, but it's not a HIPAA seminar. A little bit you need to know about HIPAA, of course. A lot of information available on the HHS Health and Human Services website for HIPAA, and it applies just to covered entities and business associates. Next slide, please. So limited application doesn't apply to de-identified data. Here's the mechanism for, I think earlier I mentioned, I don't know where I got 30 from, 18 elements that need to be removed to de-identify data. And of course, I mentioned that study out of California with the machine learning, where the study authors were able to deconstruct that data, put it back together, and re-identify. By the way, that's an anonymous person at the bottom there in that picture. A couple other healthcare laws. We've got the Genetic Information Non-Discrimination Act. Doesn't get talked about as much. Basically says that employers and health insurers are limited in how they use genetic information, especially information relating to genetic predispositions. It doesn't come up a lot, but something to be aware of, especially when we're talking about sharing health information. As this also will become, I think, more of an issue, probably something that we'll cover in a future webinar on these DNA tests that everybody's doing now. What is it, 23andMe? I have not done that, but I imagine that they are getting a world of useful information. They may be even in a situation I think Facebook was in 10 years ago, where they're gathering all this data and they don't even know what to do with it or don't know how valuable it is. But somebody's collecting DNA information on the entire world just to tell you that, in fact, your background, your cultural and ethnic background is different than what you thought it was.
And they've actually solved some murders based on that, on 23andMe and
are they using that
data? Yeah, I mean, I think you can allow it to go to some type of public registry, and the police and the FBI have access to it, and they're solving some cold cases. I think there was a case in the paper where something from the 80s was solved.
Well, and there again, you know, the police can't get that information directly without a warrant. But once you share it with a private company, it's out there for everybody. So, and anyway, I'm not sure if I would want to do one of those tests yet. I have a couple of Amazon Alexa devices around the house at home. I understand how they work. I understand that they have a mechanism to always listen, and they're triggered to come on certain buzzwords, but I don't know if I want to provide my DNA information to anybody yet. And then 21st Century Cures Act has come up just in a sense that there's some language in there trying to balance the appropriate use of this data for research and public health purposes. And again, you know, we bring up these laws, but point out that because a lot of the mobile health devices are not coming from HIPAA regulated entities, the HIPAA and other healthcare laws just may not directly apply. However, if you're providing devices in the context of a contractor to a covered entity, they could apply. Next slide. Federal Trade Commission, and gosh, we really are, and I know a lot of folks are joining us for the lunch hour. I don't want to run over, but as I said, I think this is a seminar that will end up being really something we come back to and cover in more detail on the law side for the second half. But I want to hit on the FTC laws. Here's the big picture of Federal Trade Commission. Federal Trade Commission Act is the Federal Trade Commission. This is the 500-pound gorilla in the privacy space outside of the HIPAA world. So for all these mobile apps and devices, when you see a lot of enforcement actions being brought by government agents for misrepresentations and privacy policies for unfair practices, it's Federal Trade Commission. And the Federal Trade Commission's authority is broad. It covers HIPAA covered entities and also non-HIPAA covered entities. And it's the FTC Act is their primary tool, and the act prohibits unfair and deceptive practices. And next couple slides will show some examples of where these come up in, for instance, in privacy policies. Unfairness, failure to implement and maintain reasonable security, failure to protect against known threats or foreseeable threats, a company that gets breached for, and I believe this was one of the actions in the now well-known Wyndham case that came from, Wyndham has a big presence here in Florida, and Wyndham challenged this. And the FTC, when Wyndham was breached, said that Wyndham did not implement reasonable security and went after them under the FTC Act. The FTC website is very good, and it lists all types of actions that are regularly being brought. The one example I pulled out here is a medical transcription company that did not encrypt data in transmission, and they were subject to an FTC action. On the next slide, we'll talk about, so we have two components, and they're also often put together, unfair and deceptive trade practices, but the FTC looks at them each a little bit differently. Unfair practices are not doing what you're supposed to be doing. Deceptive practices are not doing what you say you're doing. You misrepresent your level of privacy or security. You say, for instance, that you are encrypting data, and you're not encrypting the data, or you're not using current industry standards to encrypt the data. Here's an interesting one. The last bullet on the bottom of this slide, this was a company that did where patients could enter reviews for doctors, and they were led to believe that the reviews were going to be anonymous, that the patients' names were not going to be attached to these things on the internet. So if they had bad things to say, or good, I suppose, but especially if you said something that wasn't very flattering about your healthcare provider, that your name wouldn't be attached to on the internet. But there were disclosures in the fine print of the terms and conditions that said that your name could be published. And so when names were published in association with these reviews, the FTC ended up bringing in action and said, yeah, we know you put them in the fine print, but that's still deceptive. So something to be aware of, that the fine print doesn't always protect you. Yes, sir.
Another angle on this deceptive is, I see a lot where people just, when they set up a website for their organization, they just copy someone else's terms and conditions. And I don't even think they read it. I mean, they just realize they need something to fill that, the privacy policy or something.
It's
and just
terrible.
copy any, and some other one put it out there, and then, are you following this? Well, we didn't even read it. We just took it from someone else, they'll tell you. Is that, I think that's something to definitely be cautious of.
I'm going to, and I think we may sort of wrap up on that issue, because I want to spend some time, and hopefully we'll invite some folks back. We'll make all of our materials available, the written materials, but I want to really use that probably to cap off our the first half of our webinar today. And that's, you hit it exactly, Tony, is this, I see even companies that sell this stuff. You can go on online and you can buy terms and conditions for your website. And I've seen franchises and other businesses. There's a scam travel company out there that you could set up their website and you can use their terms and conditions. And you have no idea what these things say. So you're running your business and you're making representations. And the FTC has hammered some companies simply for saying that we anonymize data when you don't anonymize data. We keep our information protected behind firewalls when you don't do it. And they've gone after some big players. They went after VTech a couple years ago for that's a toy company, and I know VTech because I got little kids. VTech was not properly securing information that was provided in children's toys. And so they went after VTech for an unfair and deceptive trade practice claim. So that's huge. You really, whenever you're getting into the area of a privacy policy or your terms and conditions, you really need to take a look at that. And when clients ask me to review or to write, and on occasion I'll write terms and conditions for clients or privacy policies, and they say, well, just write something up. Well, I need to know what you're doing. I need to know, what are you doing? What are your policies? What are your terms and conditions? What are you doing with information you collect? What type of information are you collecting from people? And make sure what's on your, what you're publishing on your website is actually consistent with what your business practices are. So with that, we didn't get to a lot of information that I'd like to get to, and frankly, there was so much. I thought it was important to cover a lot of the cool issues and some of the risks in the beginning. We touched on FTC. We did not hit on the FDA. I will tell you, as just a summary note, the FDA, for the most part, if a device is not considered a medical device, they are taking a pretty hands-off approach to these devices right now, and they've actually amended the Food, Drug, and Cosmetics Act. As part of the 21st Century Cures Act, there was an amendment that basically said we're not going to regulate consumer-facing health applications. And then finally, there's various, there's the FTC breach notification rule, which looks a lot like the HIPAA breach rule and looks a lot like Florida's privacy breach notification rule. There's biometric laws that we have not talked about, and they're all over the place right now from state to state. And then there's industry guidance, and I'd like to touch on that in another webinar. So I'd like to thank everybody for joining us today.